Gender dysphoria is a complex and deeply personal experience, affecting individuals in various ways depending on the type, stage of life, and the surrounding circumstances. For transgender individuals, gender dysphoria represents a profound disconnect between their gender identity and the gender they were assigned at birth. This sense of misalignment can create intense emotional and psychological distress, often leading to anxiety, depression, and social isolation. However, not all transgender people experience gender dysphoria in the same way. Understanding the different types of gender dysphoria and their impact is crucial for mental health professionals, loved ones, and anyone who seeks to offer support. In this video, we will explore the various types of gender dysphoria, how they manifest, and how they affect transgender individuals, focusing on both the psychological and social ramifications of these experiences. We will also discuss the importance of providing appropriate support and resources to transgender people living with gender dysphoria. Gender dysphoria is the medical term for the distress or discomfort that arises from a disconnect between one's gender identity and the gender they were assigned at birth. While many people align with the gender they were assigned, others, particularly transgender individuals, experience a mismatch between their internal sense of gender and the expectations society places on them based on their biological sex. It's important to note that gender dysphoria is not the same as being transgender. Being transgender refers to identifying as a gender that is different from the one assigned at birth, while gender dysphoria refers specifically to the discomfort or distress associated with that misalignment. Not all transgender individuals experience gender dysphoria, but for those who do, it can be a significant source of emotional distress. Primary gender dysphoria, also known as early onset gender dysphoria, typically presents in childhood or early adolescence. Children experiencing this type of dysphoria may show strong and persistent feelings of discomfort with their assigned gender and may express a desire to be of the opposite gender. This type of dysphoria is often seen in children who identify as transgender before puberty. In childhood, individuals with primary gender dysphoria may show a preference for clothing, toys, and activities typically associated with the opposite gender. For example, a child assigned male at birth may prefer wearing dresses or playing with dolls, while a child assigned female at birth may gravitate toward action figures or trucks. These preferences may cause significant distress if the child is forced to conform to gendered expectations from family or peers. Some children with primary gender dysphoria also express a desire to change their physical characteristics, such as wishing they had a different voice or body. This early recognition of gender identity can be both empowering and confusing, as many children may not have the language or understanding to articulate what they are feeling. Secondary gender dysphoria, or late-onset gender dysphoria, refers to the development of gender-related distress later in life, often during adolescence or adulthood. Unlike primary gender dysphoria, where the individual may have had a sense of gender incongruence from a young age, secondary dysphoria emerges after a period of identification with the assigned gender. This form of dysphoria may develop as a person enters puberty or undergoes major life changes. It can also occur in individuals who previously felt content with their gender assigned at birth but later experience a shift in their understanding of themselves. There are several potential factors that can trigger secondary gender dysphoria. For some individuals, exposure to new ideas or communities, such as learning about gender diversity, can catalyze a shift in self-awareness. For others, life events such as entering puberty, experiencing sexual trauma, or being exposed to societal pressures to conform to gender norms can trigger feelings of distress regarding their gender identity. Individuals experiencing secondary gender dysphoria may face unique challenges. Unlike those with early-onset dysphoria, late-onset individuals may have had time to establish a sense of self that conflicts with their emerging gender identity. This can create intense confusion and cognitive dissonance, as well as a fear of rejection from family, friends, and society at large. The process of coming out later in life can be incredibly difficult, as late-onset individuals may need to break away from long-standing social roles and expectations. They may also face fears about how to navigate relationships or careers while transitioning, adding to the stress and emotional turmoil that comes with gender dysphoria. Social dysphoria refers to the distress experienced by transgender individuals when they are perceived or treated according to their assigned gender, rather than their gender identity. This type of dysphoria is often triggered by misgendering, being referred to by incorrect pronouns, or being socially expected to adhere to gender norms that do not align with one's identity. Social dysphoria can manifest in various ways. For example, a transgender woman might feel distressed when she is referred to as "sir," or when people mistakenly assume she is male. Similarly, a transgender man might experience discomfort when people refer to him with female pronouns or expect him to act in stereotypically feminine ways. Misgendering is a primary trigger for social dysphoria. However, it can also occur in situations where gender expectations are rigidly enforced, such as in workplaces, schools, or family settings. Transgender individuals may also experience social dysphoria in public spaces where they are confronted with the stark realities of their assigned gender in contrast to their true identity. The emotional toll of social dysphoria is significant. Constant misgendering or being forced to conform to gender norms can lead to feelings of frustration, anger, and sadness. Over time, social dysphoria can also erode self-esteem and increase the likelihood of experiencing mental health challenges such as depression and anxiety. The fear of rejection or discrimination in social settings can create a constant state of hypervigilance, making it difficult for transgender individuals to navigate everyday interactions. Physical dysphoria refers to the distress associated with one's physical body not aligning with their gender identity. This can involve discomfort with specific body parts, such as breasts, facial features, or genitalia, that do not match the individual's gender. Physical dysphoria can also extend to broader concerns, such as the voice, body shape, and hair growth. Physical dysphoria is often a major source of distress for transgender individuals. For example, a transgender man may feel intense discomfort with his chest and may seek chest surgery, mastectomy, to alleviate this distress. Similarly, a transgender woman might experience distress about male pattern hair growth or an Adam's apple and may opt for hormone replacement therapy, HRT, to feminize her body. For many transgender individuals, medical interventions are a key way to manage physical dysphoria. Hormone replacement therapy, HRT, is one of the most common treatments, allowing individuals to alter their physical characteristics to better align with their gender identity. Gender-affirming surgeries, such as breast augmentation, facial surgeries, or genital reconstruction, can also significantly reduce the distress caused by physical dysphoria. The impact of gender dysphoria, regardless of type, is profound. It affects not only the psychological and emotional well-being of transgender individuals but also their social relationships and physical health. Gender dysphoria often leads to significant psychological challenges. Anxiety, depression, and self-esteem issues are common, particularly when dysphoria is not addressed or when individuals are unable to live authentically. The cognitive dissonance between one's gender identity and the pressures of society can create an ongoing sense of emotional turmoil. Many individuals with gender dysphoria also experience imposter syndrome, questioning whether their feelings are valid or whether they deserve to be accepted in their true gender. Transgender individuals often face significant social challenges, including strained relationships with family members, rejection by peers, and discrimination in the workplace. Social dysphoria compounds these difficulties, making it harder to connect with others and live authentically. Misgendering and exclusion can leave transgender people feeling isolated and invisible, leading to a lack of connection with supportive communities or individuals who affirm their identity. Finally, we would like to express our gratitude for watching till the end. We hope you found the video valuable and informative. If so, please show your appreciation by hitting the like button and leaving us a comment below. We are eager to hear from you. In the end, we have a humble request to you. We are trying hard to keep you enlightened and empowered by creating awesome videos like this. Please support us by joining our membership program. The link is in the description. Your little contribution will inspire us to make more awesome content for you like this. The next video will be published tomorrow, so don't miss it. Till then, take care. More wisdom, more solutions, better life.